In this segment, we're going to demonstrate a muscle energy technique to a right-sided inferior pubic shear dysfunction. In the case of a supine patient, have them come over a little closer to you on the table so you don't have to reach over, as you're going to have the hip and knee flexed on the dysfunctional side. We're then going to flex that hip a little bit more, draw that pelvis off the table a little bit so that I can take my thenar eminence with a closed fist under the ischial tuberosity of the patient to cause a fulcrum. Then I bring my body up into the patient's knee, and I can have the patient in this position, or to get more resistance, get the patient a little bit more flexed, and then reach over and anchor the table to get more resistance. Now, at this position, I ask the patient to just gently push his knee back into my chest, trying to push me down the table, basically. And I resist that. 3 to 5 seconds and relax. Find a new barrier. If you don't feel that the thenar eminence is getting much of a fulcrum, you can bring it up a little bit more and ride up. There's better. I didn't think I had it quite right. All right, now push that knee back into my chest. And relax. And bring it up. And again, push back in. And relax. And continue that 3 to 5 times. And then afterwards, slowly bring the patient back down to a normal position in terms of where you started. And then again, reassess the dysfunction by looking at the parameters that led you to that dysfunctional diagnosis in the first place, which would be right sacroiliac motion testing, either in a standing and seated flexion test comparisons, the patient-prone sacroiliac motion testing, compressions, etc., and then looking at the variations of the pubic symphysis, right side compared to the left side. And in this case, your diagnostic method that would have determined this, that would have helped you, would have been similar to the superior pube, coming down the anterior abdominal wall, explaining to the patient what you're trying to do, find that pubic symphysis area, and in this case, your pubic tubercle would have been on the low side on the right as compared to the left. And that's how you would reassess it and diagnose it.